This week we will review external causes of morbidity codes and Z codes. So let's go ahead and take a closer look. External causes of morbidity codes. These types of codes allow the classification of environmental events or circumstances surrounding injuries. They are providing supplemental information about injuries. Although they are not required by all facilities when coding, it is very important to understand what they are and where to find them this week. So, external cause codes include codes V00 through Y99. These codes are used mainly for injury research purposes and to gather information on injury prevention strategies. We will spend more time with these external cause codes later in the semester when we review injury and burn codes. This week, however, I do want you to note that external causes of morbidity codes do have their own separate index. Please look for this index today. It is located just after the table of drugs and just before the tabular list. Again, take a few minutes this week and number one, find this index. And number two, scan through the entries in the index to get a better idea of what these codes are all about. You will see main terms such as accident, drowning, place of occurrence, activity, assault, exposure, falling. Again, things that are further describing the circumstances surrounding an injury. Again, we will work with these more later in the semester, but for now, please find this index, know where it is, become familiar with it. Maybe it's a good idea to pause the video right now and take a quick look. Now let's switch gears and discuss Z codes. Z codes are assigned for factors that may influence the health status of a patient and or contact with health services. They include codes Z00 through Z99. Z codes represent reasons for encounters, and a corresponding procedure code must accompany a Z code if a procedure is performed. Z codes have no separate index like the external cause codes that we just talked about. The Z code main terms can be found in the main alphabetic index that you are used to using for the regular diagnosis codes. So again, no separate index for these Z codes. Just use that same alphabetic index you've been using since the 1274 course. It is important to learn and keep in mind some main terms that help you track down these Z codes in the alphabetic index. Your handbook reading this week does bring your attention to a few of these main term options, such as admission, examination, history, observation, aftercare, problem, and status. Now, this is not an all-inclusive list. I always think it's a good idea to start your own personal list of Z codes, just because it helps with brainstorming when you're coding. Sometimes things don't come quickly as, oh gosh, that would be a main term for a Z code. So once you find one or hear of one or see one in your coding experience, I think it's a good idea to keep yourself a little list of these Z code main terms for future reference. A few other main terms that lead you to Z codes include encounter, test or testing, susceptibility, suspected condition, presence of, long-term use of drug therapy, screening, surveillance, dependence on, removal, vaccination, transplant status, genetic carrier, absence, evaluation, and threatened. Again, this is not an exhaustive list, but just some more ideas to help you brainstorm when you're coding. Note that this list, these are not exactly diagnoses, right? But these are things that are affecting health status or contact with health services. So that's what Z codes are, basically, not diagnoses, but those other factors that may be affecting health services. Z codes may be used as a principal diagnosis in a few situations, such as if the patient is being seen for aftercare of a condition or procedure, or if a patient is being seen for the sole or the single purpose of a special therapy, such as chemotherapy or radiation therapy, or if a person is not currently ill at all, there is no illness, but is seen by health services for a special reason, such as prophylactic care or preventative care for a vaccination, or to act as an organ donor. Z codes are also used to indicate the birth status of newborns. So in a newborn record, there is a Z code as principal diagnosis according to the place of birth and the type of delivery. We will certainly talk more about this later in the semester when we talk about pregnancy and childbirth codes. Z codes are used as secondary codes when a patient has a history, whether that's a personal history or a family history of a medical condition, or when a health status or problem is not in itself a health condition, but may influence or again affect the care which is given to the patient. Z codes as a secondary diagnosis are also used when coding for the outcome of a delivery of childbirth. So again, we will discuss this later in the semester. Let's go a look and take a closer look at two examples of finding Z codes so you can just get a better handle on this concept. Our first example is for the documentation of family history of breast cancer. A Z code would be assigned as this would influence patient care. For example, many insurance companies would cover an annual mammogram after, let's say, I think the age of 40, right? However, if there is a family history of the condition, the insurance company may cover the mammogram at an earlier age. So let's say we have a 34-year-old. This patient is coming in for a mammogram and the insurance company is questioning this. Why is this 34-year-old coming in so early in her life for this mammogram? Well, by coding the family history, the insurance company is alerted as to why the particular mammogram should be covered. So let's start with the alphabetic index with the main term of history. Now be careful with this main term. Please note that there are two very wide-ranging subterms that come along with this history main term. There is history family and history personal. So here we have close family history of a condition, and here we have the patient's own personal history of a condition. So make sure you are being very careful when using the history subterms. In this case, we will go to history subterm of family, just as it's documented up here. And then we will find the subterms family history of malignant neoplasm of the breast. This leads us to code Z80.3. And of course, you just like any other code, you want to be sure to go back and check the tabular list for this code to see if there are any other instructional notes included. Looking at another example of a Z code, this time let's pretend a patient is being seen for a complicated cardiac procedure. And as we're reviewing the medical record, we see this phrase that the patient had a previous kidney transplant. It would be a good idea to note the presence of the past organ transplant, that the patient has this transplanted kidney, because it may affect the current treatment during the procedure for the cardiac issue. So in this case, to pull in this status of the past kidney transplant, you would go to the main term of transplant and then subterm kidney. And here this leads us to code Z94.0, and again, you would want to check the tabular list. Be sure to completely read your handbook and complete those assigned exercises this week and practice using those Z codes. Happy coding!